undergraduation pass out from Armed Forces Medical College. In my experience and in building up my surgical career also, I have had an exposure of about 4.5 years as a general surgeon, after which I appeared for my super specialty examination. So I had a lot of battle casualty patients whom I needed to treat, a lot of mass casualties also. So that's how I developed my interest for trauma surgery. Gradually, I started with this only. And as I progressed on to the lectures, and one has to have faith in one system and just continue in that. For instance, in my case, trusted completely in your teaching methodologies and in speed. The questions can be very random. The way it has been covered in speed, excellent, sir. I mean, nothing was left.
I bring in all the wishes and greetings on behalf of all the faculty members and team of Speed to Dr. Zenith Mohanty for scoring AML rank number 1 in MCH trauma surgery in INISS session November 2023. Congratulations.
Thank you so much, sir.
Great to have you today's session, Doctor, and to interact with you. It's our pleasure. Now, can you tell us where you started your career from, what all you have done till date?
Sir, I am a undergraduation pass out from Armed Forces Medical College, and thereafter I did my PG from Army Hospital R&R from the ages of Delhi University, and I am an Army candidate. So I have spent a good amount of work in actually in my experience and in building up my surgical career also. I have had an exposure of about 4.5 years as a general surgeon, after which I appeared for my super specialty examinations.
Very, very, very nice of you, Doctor. Nice to know and great of you. I mean, what is the position right now you hold in the services?
Sir, I am a Lieutenant Colonel, sir.
We have a lot of regards for you and also all people from Army services. Because for two reasons. One, you are at the medical service itself is meant for the society, for the community. Same time, you are doing a service for people who are in war zone and protecting our nation, and you are dedicated in both the vices. We have a lot of respect as Speed Medical Institute and also all faculties, and as personally from my side, great respect for you. And it's an honor to talk to you today.
Sir, thank you, sir.
And we wish to know the interest for trauma surgery. Is it because you are involved in your services for that reasons, or basically you had that even during your MBBS? When it started, can we know about it?
Sir, it actually started as my career progressed in general surgery only. So I had a lot of battle casualty patients whom I needed to treat, a lot of mass casualties also. So there, especially after a lot of war conflicts which happened in the recent times, a couple of years back. So getting involved in that and being a forefront surgeon, so that's how I developed my interest for trauma surgery. So as I have heard all your classes, you always used to say, sir, that whatever you like, you have to fight for it. I mean, sir, like I always used to hear those words of yours and your little anecdotes also. And so what I believe, sir, ki rather than having a like, one generally tends to have a screening process. Okay, these are 3-4 subjects I don't want to take, and these are 2-3 subjects I would like to take. So that's how I also had 2-3 options with which this actually fitted my career and my interests perfectly.
Great, Doctor. Very good. Now, can we know the process, how you prepare? Because I came to know that you have an exam in the services only for you to appear for this exams, to qualify those exams want to come on to this. And then when did you start your preparation? How did you prepare for this program? And can you tell us how one should prepare for this? What you did, we can know so that people can learn.
So we have an exam in the services that is about in the month of March, April. So wherein as per our merit and as per our choices, we take up our subjects. We have vacancies in various subjects. So we choose our subjects. After choosing our subject, we give those specific exams. Like for example, I chose trauma. So in trauma, I appeared for AIMS because of course NEET did not have any trauma seats anywhere. So MCH was available in AIMS. So that was my first chance and my first also interest also. So I took up that way. So my preparation began actually about 7 months before my exam in the forces. After that, also I got a period of about 4 months in which I could recapitulate and revise what I had done for that exam.
What is the methodology of preparation? What did you do? How did you prepare?
Actually, I was recommended speed by one of my seniors only. She was last year's topper, Dr. Ashia, in reconstructive surgery. She is one of my seniors. She only recommended
Correct.
and gradually I started with this only. And as I progressed on to the lectures, so I'll be frank, sir, it was very not possible for me to attend all the live classes because the timings did not suit me. But then I used to go back and see those lectures gradually. I used to like you said, sir, first rule, no pre-PG books. So that is what one thing which really helped me, sir, because at this stage we are in a constant, we get a lot of inputs and we have to filter and select what actually suits us. So we are actually at that stage. So, and one has to have faith in one system and just continue in that. For instance, in my case, I trusted completely in your teaching methodologies and in speed. So I used to take those video lectures. Like for there were 6 7 modules which I had taken. For example, I started with the GS surgery basics concepts, that classes which is taken by user mostly, and then I took upon Bailey. First I did the 27th edition, then I progressed to 28th edition because 28th edition was new and it was being uploaded one by one. So
Very
I did.
exhaustive also. Compared to 27th,
Yes, yes,
28th is
it is
very
very
exhaustive.
exhaustive and it is fantastic, sir. It is fantastic. And especially in the lectures where it was highlighted all the additions which have been made in the new edition. So that was very good, sir. And then I especially liked the integrated module in which Sebiston, Schwartz and Bailey, all three were integrated along with what has come in the exams and all. So that was one of my favorite modules to say. And after that I finished with the general surgery GS classes and finally the FAQs, the high yield questions. So that those were the core modules on which I focused. I used to make notes, sir. I am a meticulous notes maker. I keep scribbling. As you say, I run the video at 1.25x and I keep scribbling things. And I have copy for all your subjects, urology, GI surgery, and everything. So I made 6 registers, sir.
Wow.
And all thick 300 pages of each register.
Oh.
And we could finish all this before my first internal exam. And during the interval from being selected in my forces exam to the actual INI exam, all I needed was to revise all these 6 copies over and over again.
Okay, very good, doctor. In the exam, on 80 questions, can you share your experiences? What are they asked? What are the proportion of questions which you are asked? Can you tell us on those things?
In INI, sir, it is 40. It is total of 80 questions. 40 questions is general surgery, and they can be completely random, sir. I mean, it is difficult to like. There was a question on essential amino acids. Now, frankly speaking, we have all forgotten it, sir. No one remembers it. So, which is not an essential amino acid. It was all the answers were looking similar. So it's like that. And for 40 questions, half of it is your subject based. For trauma surgery, one very good thing that I could do and which I would like to make a suggestion also request to you, sir. If the ATLS, the ATLS 10th जो है, that if it can be included in a couple of classes.
Yeah, you should
So
include.
there were, yes sir, it will be very beneficial because there were about 15 questions from ATLS, direct ATLS manual which is there sir, 15 questions direct. Now it is difficult to, I mean, determine at my stage whether it was from the trauma part of it or whether it was from the general surgery part of it. But there are certain distinct things in that. Since it's a protocol, so there is very less chances of it going wrong. So
Correct.
it would benefit the students a lot if a couple of classes can be.
No, we will sure include in trauma session on ATLS.
Sir, yes sir. So that was one thing, sir, and the questions can be very random, but the way it has been covered in speed, excellent, sir. I mean, nothing was left. Of course, there will be a few ectopic questions like this essential amino acid. I mean, no one can. I mean, these are specifically questions so that no one attempts. One suggestion that I would like to share with the viewers is that from the 80 questions, 50 I was very confident. So I did it in one go. And then another 15 questions, I took a calculated guess. And 15 questions, last 15 questions, I just left it. So last half an hour of the examination, any examination, I realized that one should never attempt any new guesses or any new questions. In any examination, one has to go from question 1 to question last question at least 3 times. One should make that kind of time management. And in the last half an hour, no new questions, because 80 to 90% of the guesses we make in the last half an hour because of that pressure generally turns out to be wrong, sir.
Okay, doctor. Now, the message to the students who are aspiring for MCH trauma surgery.
My message is firstly, you really need to focus. I mean, trust the system. I mean, if a system has been designed by speed, so one has to trust it and one has to cover it from end to end. Nothing is to be left, sir. Nothing. I mean, there are some questions which I may not have been able to revise in the third revision, but somewhere I will recollect that you had said it in this way and you had made some little anecdote on that. So that associative memory, as actually that paired associative learning sticks to it and it comes to you during the time of need, during the exam. So to trust a system, and as you always say, sir, no pre-PG books, they're actually not worth it, sir. Matlab, because again, once before also I had done in that way and it did not help me at all. No pre-PG books, and to make at least 3 revisions. And of course, sir, as I suggested and you have kindly accepted, sir, that a couple of classes on the ATLS manual. So that will help the students a lot.
Sure.
And this is a very
in case if you wish, you can do the those classes also, and it will be of great help to the students. I invite you for that.
I'll do my best, sir.
Yeah.
And I also followed Dr. Basant. Again, he is one of my very great teachers, great teacher actually, sir. And after that, I would always suggest, sir, 3 revisions are a must. So that is one thing that one has to follow by the rule. 3 revision has to be done. And rest, sir, your good wishes. Nothing is stopped. Trauma is a very new branch, sir. What I realized after I interacted with my seniors, it is a very new branch. It has, the MCH has started in AIMS after 2018, and actually seats are lying vacant in this. It has got a good scope outside, and since we are being a new branch, so we are like pioneers of the subject. And AIMS is a fantastic institute. So one should consider this subject. If one is interested, then it is actually worthwhile.
Great, doctor. And time to thank, and whom all you want to thank who have been with you to build your career so far, you can do so.
I am very thankful to my wife for supporting me throughout, my parents, and all my friends and my seniors. and most of it who actually directed me to be a part of, be associated with speed, because it's not just learning, it's not just academics. There are a lot of practical things that you have taught us, like those few incidents of having a good anesthetist, having a good radiologist, things like that, that you have taught us, which somehow brick by brick build your personality as a surgeon in your surgical career. So these are, having a fantastic teacher like you is actually a blessing, sir. It's a blessing. So I will also like to take the help of this platform to thank you immensely. I'm immensely grateful to you, not
Thank you.
only for the success of this exam, but also to build my personality as a surgeon in this surgical career.
Thank you, doctor. Now, we once again wish you all the best and all the success for a great career in trauma, and you are in a great services to the nation. And on top of it, when you have this specialty in your hand, and it is 100% life saving throughout your lifetime, and will be saving the life throughout your lifetime in your career, and it's the most fruitful specialty that one can have in military services and army services. For that, our respect to you, our wishes to you, and whatever you do from now on, and have great success in your career, and all the best to you always.
Sir, thank you so much, sir. Thank you.
Thank you.